Hey guys, it's Dee. Welcome back to my channel. So in today's video, I wanted to show you guys a tool that is very helpful when you think you might have fibromyalgia, or maybe your medical provider thinks you do, but they're not really for sure. So this is a clinical tool that has been created as a diagnostic criteria tool thing for the patient to take. And I have seen a lot of rheumatologists that I've worked with when I was a nurse in rheumatology. If they were suspecting fibromyalgia, they would go and give this paper to them for them to fill out to help give that harder evidence. You know what I'm saying? And the reason why I want to share this is because it's not a well-known tool. I did not know it existed until I worked in rheumatology for a while. And what I found is that there's a lot of misconceptions, a lot of misinformation and inaccuracies out there about fibromyalgia, and that permeates even into the medical field. You know, there are a lot of providers and people who are not familiar with what it really is. There are still some providers who think that is a psychological issue, and it's not. It's a neurological issue. There are a lot of people who still think that it's not even a real condition, and it is. The reason why it's considered a rheumatology condition is because they basically the community didn't really know what to consider it as, and rheumatology gets all the stuff that we can't explain, even though it's not an autoimmune condition. So if you want to know the difference between rheumatoid arthritis and fibromyalgia, I have a video on that already, and I will put a card in there so you guys can check that out. But I'm going to show you guys this tool and how it has been helpful for even for me to get diagnosed with fibromyalgia, because I didn't get diagnosed until after I started working in rheumatology, after I already got my rheumatoid arthritis stuff. So I'm just going to shift over to screen share real quick. Okay, so let me put this in. There we go. So this right here is the clinical fibromyalgia diagnostic criteria. This is, to my knowledge, the most up-to-date version of it. They've been trying to come up with a more objective way to diagnose fibromyalgia, because a lot of the symptoms that you feel with fibromyalgia, it's more like subjective. So it's like, you know, your pain level, like people can't really measure it. It's, you know, whatever the person says it is, you know, so it's harder to quantify that versus like a blood pressure number. You know, there's no arguing with that number. Like the number is the number, you know what I'm saying? So what they're going to look for is this part one, and they're going to have you tell them how much you felt these symptoms, starting out with pain, in the past week. And then they're going to want you to either mark on the actual person, or they want you to put a check mark here where you've had the pain. So all of these different areas, you can have pain. So you see that chest pain, yeah, you can have chest pain. I've been there. Chest pain don't always mean a heart attack. It could be a fibromyalgia thing, especially if all the cardiac heart attack stuff comes back normal. Could be this. Could be gastric issues, because you can have gastric issues. You can have neck pain, upper back, lower back. It's not just like those tender points. One of the older ways that people would diagnose fibromyalgia is like counting how many tender points you have in the body. That is outdated. So that's one of the other reasons why I'm showing this. Not that tender points don't have a place, but that by itself isn't enough for fibromyalgia, because not everyone's going to have pain points everywhere and that's it. You know what I'm saying? There are so many other symptoms, and I'm going to show you guys in the next page. So then they would have you count up all the numbers, checked, up here for all the different places that you hurt in the past week while you've already been on whatever pain med you're on, and they're not going to have you count stuff from other known stuff. So like when I had rheumatoid arthritis, I'm not counting that pain, I'm counting like the different pain, if it couldn't be like confusing enough. Okay, and then you're going to put that here. The number of places that hurt is going to be what's called your widespread pain index. So it's just a number, put that there, and then just remember it. So then the second part, you know, if you have fibromyalgia, chronic fatigue syndrome, or any autoimmune condition, you see how they're all the same? You know, you can have this in all of these. But with this one, they want you to look at your symptoms over the past week and say, how bad was your fatigue for this past week? How bad was it that you wake up unrefreshed? Because that's very common with fibromyalgia and chronic fatigue syndrome and ME. You know, you could sleep 12, 13, 14 hours and still not feel refreshed. It's that pervasive. And then cognitive symptoms, they're talking more like the brain fog type stuff, you know, so like being more forgetful or feeling like more disoriented because your body's just that depleted that it's functioning as if, like I would say it was as if I felt like I was drunk and I wasn't, you know, so how bad it is. And another reason why I like this is because if you get to a point where you need to apply for disability really likes to see, oh, it's disturbing and interfering with work, or it's interfering with your life. This is like documentation to help support that, which is helpful when you're dealing with a condition that you can't measure the same way you can measure like high blood pressure. You know what I'm saying? So it's another little note to keep there. A lot of providers don't know this is out here, and a lot of people don't. So even if your doctor's aware or thinking fibromyalgia, don't hurt to bring this in, because it's like it's documentation that can go into your medical record. And that's what you want. Okay, so then you tally up your total for these three things right here. And you're going to enter it here, just a number. Okay, now we're going to go to the second page. You see all these symptoms up here? That's all the symptoms you can have in fibromyalgia, which is why it's so hard to diagnose, because I can look at all of this stuff and I'm like, well, I was having that with rheumatoid arthritis too. Or, oh, people have that with lupus. Oh, people have that with psoriatic arthritis. Oh, people have that with ankylosing spondylitis. There's so many different things. And that is why it's so confusing for providers, especially when the providers are used to more objective stuff, like I said, with like high heart rate, high blood pressure, you know, diabetes. You're looking at hardcore numbers. So there's no argument with that. Rheumatology and fibromyalgia is more of a gray art. You know what I'm saying? Like you really, it's its own special art that doesn't exist in a lot of other specialties. So it's very common for all of these issues, because they're so vague, to be misdiagnosed as something else. You know, you could have, see, muscle pain is the one that most people think of, but you could have seizures. You could have dry eyes. You could have a rash, sensitive to the sun. You could have chest pain. You could have fever. You can have Raynaud's, which is a condition where like your fingers, hands, toes, feet turn blue, like they look like there's no oxygen going to them. And you see with all of these different conditions, you see how they could be, it could just be a problem by itself. Like you could have Raynaud's by itself, but not have fibromyalgia. You could have dry eyes by itself and not have fibromyalgia. You could have dry eyes and you have Sjogren's syndrome. You know, see how confusing this is? So you could have just insomnia by itself, numbness and tingling. Yep. And so they're going to ask for symptoms over the past week. You're going to count up the number and you're going to put your score here, and then you add all three of those tallies up, and that is the symptom severity score. And this does not by itself diagnose you. Okay, so you cannot just go and fill that out and diagnose yourself, or go and be like, doctor, I have this. You can't go and do that. But what it can do is open up that conversation and give you extra clout to be able to turn into your provider and be like, look, I took this thing, I'm scoring this, which kind of suggests that this might be an issue, and I wanted to know what your thoughts are. Even though this test or diagnostic tool can be completed and they're just asking for like your symptoms over the past week, another thing that doctors look for is that you've been having this for weeks, plural. So not that you just happen to score high on this one time and that's it. You know what I'm saying? Because doctors and nurse practitioners and providers, they are trained to look at first acute versus chronic. So if you just are coming in and you've only been having like a headache or muscle pain for a couple days, and that's it, they're going to be thinking an acute. So they're not thinking you have a disease. They're thinking it's an injury. You know what I'm saying? First, you have to get them to think and understand why you think this is a chronic issue. So like if I had joint pain for like a couple of days, that's not enough to get me a diagnosis of the disease. They could just think that I had some sort of injury or something, versus, oh, you've been dealing with this for a couple months now. Oh, you've been dealing with this for 6 weeks and all these things you're trying isn't helping. Oh, okay. That's going to key them in. Oh, okay. This might be a condition. This isn't just all in your head. And one of the things that I did want to also throw out there, fibromyalgia is a neurologic issue. Does it have some psychological consequences? Yeah. I mean, I think most people would be pretty depressed or anxious if they were in pain all the time or had it amplified. That being said, the cause is not psychological. You know what I'm saying? Like, you're not getting this because you're depressed. You know what I'm saying? It is an actual like neurological, like wiring issue going on with the brain that is way too active. And this part of your brain that controls all the involuntary stuff, which means like the stuff you can't control. Like you can't control how fast your heart rate is. You can't just be like, you know what? I want my heart rate to be 40 today, or I want my blood pressure to be normal today. You know what I'm saying? You can't just tell your brain to do that like you can tell your hand to go and wave. You know what I'm saying? That aspect of the brain has issues. Either it's failing, it's overactive, underactive, something. That's what leads to stuff like this. That is what leads to chronic fatigue syndrome. So don't let anybody tell you that it is in your head, because that's not true. Don't let anybody tell you it's a psychological issue. The psychological stuff is a symptom, not the cause, at least as far as I know. If anyone knows any better, feel free to let me know. But this is the tool I wanted to show you guys. So like I said, I'm not a doctor. I can't diagnose you. Hold on 1 minute. But this is going to be very helpful for you to have that conversation with your doctor. Let me stop share this. I have to actually go real quick because I heard knocking at the door. So let me know what you guys think. Okay, I'm gonna leave a link to the file in the description box and in the comments, and I'll see you next time. Bye.